Alert! Spot these 10 sneaky colon cancer signs you might miss. Did you know that colon cancer is the third most common cancer in the United States and the second leading cause of cancer deaths? Colon cancer. Two words that can be really scary to hear. The colon is a part of the body that many people find embarrassing or uncomfortable to discuss, which can make it difficult to talk about symptoms or seek medical help, potentially delaying diagnosis and treatment. But the truth is, it's a topic we should discuss more often. Recognizing its signs early can be crucial for effective treatment, and that's exactly what we will focus on today. In this video, we will explore some of the sneaky signs of colon cancer that you might miss and why it's so important to be aware of them. When it comes to colon cancer, a lot of people think it only affects older adults, but the reality is it can affect anyone, regardless of age. The American Cancer Society estimates that nearly 1 in 5 colon cancer cases occur in people under the age of 50. So, whether you're 25 or 75, it's essential to understand the signs of colon cancer and take your health seriously. You might think, but I'm healthy, I'm fine, and that's great. But the thing is, colon cancer can be a silent killer. It can creep up on you when you least expect it, and it might be too late when symptoms appear. So let's arm ourselves with knowledge and talk about the signs you need to watch out for. Anyone can get colon cancer, and it's not just about genetics or family history. Lifestyle factors, diet, and even stress can all play a role. The key is to be proactive and take control of your health. The earlier colon cancer is diagnosed, the better your chances of survival. Whether you're 20, 30, 40, or 50, it's essential to understand the signs of colon cancer. A neighbor was diagnosed with colon cancer at the age of 32. She had no symptoms, no family history, and was otherwise healthy. But one day, she went in for a routine screening, and that's when they found it. She's lucky to be alive today, but it was a horrifying experience. If you're already experiencing some of the symptoms we're about to discuss, don't brush them off as nothing. Take your health seriously and take action. In this video, we will also discuss a few healthy habits and preventive measures to significantly reduce your risk of colon cancer. So sit patiently and watch this video to the end. Please subscribe to this channel if you have not done so. We would love to know where you're watching from. Okay, so what are these sneaky signs of colon cancer that you might miss? Let's dive in and explore them together. Number 1 on our list is unexplained weight loss. Imagine this. You step on the scale and notice you've lost a few pounds. That's great, right? But what if you haven't been dieting or exercising more? Unexplained weight loss can be a red flag, especially when it comes to colon cancer. You see, colon cancer can cause weight loss in a few sneaky ways. Plus, those pesky cancer cells require a lot of energy to grow, which can divert resources from your body's normal functions and lead to unintentional weight loss. Cancer can even mess with your metabolism, affecting how you process food and use energy, which can also result in weight loss. And in some cases, colon cancer can affect your appetite, making you feel less hungry. Number 2, rectal bleeding. Seeing blood in your stool can be alarming, and rightfully so. While it's not always a sign of something serious, it's definitely a symptom you should never ignore. Rectal bleeding can have a variety of causes, ranging from relatively harmless conditions like hemorrhoids to more serious issues like colon cancer. In the case of colon cancer, bleeding often happens when a tumor grows and disrupts the blood vessels in the colon or rectum. This blood can mix with your stool, giving it a red or even black tarry appearance. Number 3, changes in bowel movements. Have you ever noticed that your bathroom habits aren't quite regular? Changes in how often you go, the consistency of your stool, or even its color can all be signs that something might be up with your colon. You see, when it comes to colon cancer, tumors can mess with the normal functioning of your intestines. This can lead to all sorts of changes in your bowel movements. You might find yourself struggling with constipation because a tumor is partially blocking things up. Or you might experience diarrhea because your colon produces more mucus in response to the cancer. Your stools might even become thinner or ribbon-like if a tumor gets in the way. And of course, you might find yourself running to the bathroom more or less often than usual. While occasional changes in bowel movements are regular, persistent or significant changes warrant a visit to your doctor. Don't dismiss these signs, as they could be your body's way of signaling a problem. Number 4 is abdominal pain or cramping. We all experience stomach aches and cramps from time to time, right? But when those tummy troubles persist, it's time to pay closer attention. Persistent abdominal pain or cramping can be a sign of something more serious, especially when it comes to colon cancer. You see, a growing tumor in the colon can sometimes partially or completely block the passage of stool. Imagine a kink in a garden hose. That's kind of what's happening in your intestines. This blockage can cause pressure buildup and uncomfortable cramps or a persistent ache in your abdomen. The pain might be dull and constant, or it could come and go in waves. Other symptoms like bloating, constipation, or nausea might even accompany it. Now, don't panic if you experience the occasional stomachache. But if the pain is persistent, severe, or accompanied by other concerning symptoms, it's crucial to see your doctor. They can help determine the cause of your discomfort and rule out any severe underlying conditions, including colon cancer. Have you found this video helpful so far? If yes, please like and subscribe. Now let's move on. Number 5, bloating or discomfort. We've all been there, that uncomfortable stuffed feeling after a big meal. But what if that bloated feeling sticks around, even when you haven't overindulged? Persistent bloating or discomfort, especially after eating, can be a sign that something's not quite right in your digestive system, and it could even be linked to colon cancer. When a tumor grows in the colon, it can obstruct the normal flow of food and waste through your intestines. This can lead to a buildup of gas and fluids, causing that familiar bloated sensation. You might also experience abdominal cramping, a feeling of fullness, or even nausea. It's important to remember that bloating is a common symptom with many possible causes, from food intolerances to irritable bowel syndrome. But if you're experiencing persistent bloating that doesn't seem to have an obvious explanation, or if it's accompanied by other symptoms like changes in bowel habits or unexplained weight loss, it's definitely time to see your doctor. They can help determine the cause of your discomfort and rule out any severe underlying conditions, including colon cancer. Number 6, gas and discomfort. We all experience gas from time to time. It's a normal part of digestion, and let's be honest, it can be a little embarrassing. But what if you're experiencing excessive gas or discomfort that just won't go away? It might be a sign that something's amiss in your digestive system, and it could even be linked to colon cancer. You see, a tumor in the colon can disrupt the normal flow of food and waste through your intestines. This can lead to a buildup of gas, causing bloating, discomfort, and even those embarrassing moments we all try to avoid. You might also experience changes in bowel habits, abdominal pain, or a feeling of fullness. Now, don't get alarmed if you have the occasional bout of gas, but if it's persistent, severe, or accompanied by other concerning symptoms, it's definitely worth talking to your doctor. They can help determine the cause of your discomfort and rule out any serious underlying conditions, including colon cancer. Number 7, feeling full or unable to eat. Ever have that feeling where you just can't seem to eat another bite, even when your favorite meal is staring you in the face? Or maybe you've noticed a sudden decrease in your appetite and food just doesn't appeal to you like it used to. While there are many reasons why you might feel full or lose your appetite, it's essential to pay attention to these changes, especially when it comes to colon cancer. You see, a tumor growing in the colon can create a sense of fullness or early satiety, even if you haven't eaten much. It's like your body is telling you there's no more room in your stomach, even when there is. This can happen because the tumor is physically obstructing the passage of food through your intestines. Or it could be due to changes in your body's hormones and digestive processes. If you're experiencing persistent feelings of fullness, a decreased appetite, or difficulty eating, it's important to talk to your doctor. They can help determine the cause of your symptoms and rule out any serious underlying conditions, including colon cancer. While these symptoms can be caused by various factors, from stress to medication side effects, it's always best to err on the side of caution and get checked out. Number 8 is diarrhea or constipation. We all experience the occasional bout of diarrhea or constipation, right? It's just one of those things that happens from time to time. But what if those bathroom troubles become a regular occurrence? If you're experiencing persistent diarrhea or constipation, it's essential to pay attention, as it could be a sign of something more serious, including colon cancer. You see, a tumor in the colon can disrupt the normal rhythm of your digestive system, leading to changes in bowel habits. It can either speed things up, causing diarrhea, or slow things down, leading to constipation. Imagine a traffic jam in your intestines. That's what happens when a tumor obstructs the flow of waste. This can lead to uncomfortable symptoms like abdominal pain, bloating, and a feeling of incomplete evacuation. Now, don't panic if you experience the occasional bout of diarrhea or constipation. But if these changes become persistent or severe, or if they're accompanied by other concerning symptoms like blood in your stool or unexplained weight loss, it's definitely time to see your doctor. Have you found this video helpful so far? If yes, please like and subscribe if you have not done so. Number 9 is feeling extremely tired. We all have those days where we feel entirely drained, right? Maybe you had a late night, a challenging workout, or just one of those days where your energy levels are running on empty. But what if that feeling of exhaustion becomes a constant companion? If you're feeling extremely tired or weak for no apparent reason, it's important to pay attention, as it could be a sign of something more serious, including colon cancer. You see, colon cancer can sometimes lead to iron deficiency anemia. This happens when tumors in the colon bleed slowly, often without any visible signs in your stool. This blood loss depletes your body's iron stores, essential for making healthy red blood cells. And without enough of those red blood cells to carry oxygen throughout your body, you're left feeling tired, weak, and even short of breath. Now, don't jump to conclusions if you're tired. Fatigue can be caused by various factors, from stress and lack of sleep to other medical conditions. But it's crucial to see your doctor if you're experiencing persistent and unexplained fatigue, especially if other symptoms like pale skin, dizziness, or shortness of breath accompany it. They can help determine the cause of your fatigue and rule out any underlying conditions, including colon cancer. Number 10, vomiting. We all experience an upset stomach occasionally, maybe after eating something that didn't agree with us. But what if vomiting becomes a persistent problem? Suppose you're experiencing frequent or projectile vomiting, especially if other symptoms like abdominal pain or constipation accompany it. In that case, it's crucial to pay attention, as it could be a sign of a blockage in your colon, potentially related to colon cancer. When a tumor grows in the colon, it can obstruct the normal flow of food and waste through your intestines. This blockage can lead to a buildup of pressure, causing nausea and vomiting. Think of it like a clogged pipe. Eventually, the pressure builds up so much that the contents have nowhere to go but back up. Now, it's important to remember that vomiting can be caused by various factors, from a stomach bug to motion sickness. But if you're experiencing persistent vomiting that doesn't seem to have an obvious explanation, or if it's accompanied by other concerning symptoms like abdominal distension or an inability to pass gas, it's crucial to seek medical attention. Your doctor can help determine the cause of your vomiting and rule out any serious underlying conditions, including colon cancer. Below are some preventive measures to take. 1. Get screened regularly. See colon cancer screening as a superhero for your health. It's the most powerful tool we have for preventing colon cancer. Screenings can detect precancerous polyps, abnormal growths, in the colon and rectum so they can be removed before they even have a chance to turn into cancer. It is advisable to start regular screenings at age 45 or earlier if you have risk factors. There are various screening options, so talk to your doctor about which is right for you. 2. Embrace a healthy lifestyle. Your lifestyle choices play a starring role in your colon health. Think of it as creating a superhero team to fight colon cancer. Each healthy habit is like a team member with unique powers. Also, maintain a healthy weight. Excess weight can increase your risk, especially around the middle. Aim for a healthy BMI and keep that waistline trim. Next, get moving. Physical activity is like kryptonite to cancer cells. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Find activities you enjoy, whether dancing, brisk walking, swimming, or playing sports. And don't smoke, because smoking is a major villain in the story of many cancers, including colon cancer. If you smoke, quitting is one of the best things you can do for your health. Not forgetting, limit your alcohol intake. Excessive alcohol consumption can increase your risk. Moderation is key. 3. Fuel your body with superhero foods. Your diet should be considered as the fuel that powers your superhero team. Fill up on foods that fight cancer and limit those that might help the villains. Load up on fruits, veggies, and whole grains. These fiber-rich foods are like a protective shield for your colon. They help keep things moving smoothly and reduce your risk. Limit red and processed meats. Red meats like beef, pork, and lamb, and processed meats like bacon, hot dogs, and sausage have been linked to an increased risk of colon cancer. Enjoy them in moderation. Choose healthy fats. Opt for healthy fats in foods like avocados, nuts, seeds, and olive oil. These fats can help reduce inflammation and protect your cells. Early detection is key. Colon cancer is often highly treatable when caught early. Small changes make a big difference. Even incorporating a few healthy habits can significantly reduce your risk. Each of these symptoms might not seem like a big deal on its own, but if you're experiencing multiple symptoms, don't brush it off as if it is nothing. Take your health seriously. Did you know that in the United States, more than 60% of colon cancer cases are diagnosed in people who have no symptoms at all? That's why getting regular screenings is so important, even if you're feeling healthy. If you have any thoughts on this video, please comment below. Share your experiences, ask questions, or let us know your thoughts. And if you like this video, be sure to subscribe for more health-related content. Before you go, we have selected these videos for you to watch. The links are in the description. We'll see you in the next video.